Hey guys, it's Dr. George Forgan-Smith here, and I'm here with the wonderful physician Jason Ong, and we wanted to talk briefly today about the importance of rectal exam as part of a comprehensive sexual health screening. Thanks, Dr. Ong. Could you just tell us a little bit about your research?
Yep. So anal cancer is quite common, relatively common in men who have sex with men living with HIV, particularly over the age of 50. And the sad truth currently is that at diagnosis, the average size of cancers that we're currently detecting is about 3 centimeters, which is way too big. So we need to work out a way to diagnose these cancers a lot earlier. So our recommendation is that men who have sex with men living with HIV over the age of 50 should get an annual DARE, or a digital anal rectal examination. So what we're trying to do is we're trying to pick up these cancers a lot earlier. And that will make a huge difference to patients in terms of the morbidity and even mortality associated with anal cancer. So I hope that as GPs, if you do have this population, remember they are at high risk for anal cancer, and they should have this examination, and even just a visual examination. We found that more than 50% of these cancers, even without a digital exam, just looking, you'll be able to pick up the cancers.
If you do find a lump or some other change that's of concern, what's the next pathway for a GP?
Yep, so if you're comfortable to do a proctoscope or an anoscope, you can actually try to look inside yourself and see whether there's anything that's obvious, like a hemorrhoid or a wart. But if you're ever in doubt, get a colorectal surgeon to have a look, and what they'll do is they'll do a biopsy, and that will determine whether it's a malignancy or it could be something else.
In the population of men who have sex with men, is it advisable can any colorectal surgeon, or is there particular groups in some of the bigger cities that you would recommend people see?
Most colorectal surgeons would be comfortable to at least do the initial stages of doing the biopsy, but I guess dealing with the anal cancer, if it is detectable, probably better in the tertiary sort of centers. And particularly the main sort of treatment is, if we catch it small enough, all they have to do is just cut it out. Much like a skin cancer on the arm. But if it's a bit bigger than a centimeter, what they need to do is chemoradiation, and I would suggest going to a tertiary hospital for the expertise in that.
Okay. Is there, in addition to the regular exam, what are the current recommendations for vaccination in regards to anal cancers?
Yeah, that's a good one. So, I mean, as you know, many of our young guys are already being vaccinated through schools. So HPV vaccines are fantastic. They are the game changer. They will protect these guys against anal cancers and oral cancers in the future. But for our current cohort of people who haven't been vaccinated, it's quite controversial. I guess our current recommendation at Melbourne Sexual Health Centre is that if you've already been sexually active for a long time, the chances are that the vaccines are probably not going to help you because you've already been exposed to the HPV. But if you've had relatively few numbers of lifetime partners and you can afford the money, because it does cost about 400 plus, you can get the vaccine, and that will protect you against the strains that causes anal cancer.
Fantastic, thank you very much. If people would like to learn more about this area, is there a website that you can recommend?
Yeah, so just behind me, www.anal.org.au /clinician. And you'll find a lot of resources there. We've also got a video of how to do a DARE if you're not comfortable with doing that. It's actually quite different from a prostate exam. So I know GPs are fantastic at doing prostate exams, but this is a little bit different. So it's still worth having a look at the video. And we've also put on there an atlas which shows some anal pathologies, common anal pathologies, and a diagnostic pathway as well. So if you're not sure of what to do, it's all on the website. And if you still have questions, please write to me. I've also got my email on here, at the bottom here, and I'll be very happy to answer any questions.